next topic for discussion again is hepatitis. When we talk of viruses, some of the viruses, as we've been talking about, remain challenge as well. And one of the things that I myself in my clinical practice have realized that of all the patients, chronic disease patients you want to deal with, some of the severe form of illnesses that I have seen in terms of chronic illnesses is hepatitis, because of the fluid that accumulates in the abdominal cavity called ascites. And sorry, you cannot hear me? Well, I'm going to suggest to you to come down, because there's a lot of noise at the back. I think there's a resonance there. That's what I figured out. Okay, is it better? Okay, so you can see from here abdominal distension, and this kind of case that you normally see in chronic alcoholics, cancer, liver, spleen, any other. But again, this is a classical case, again, for the public awareness that especially from CDC, and especially this, actually I got it from the Department of Public Health, Illinois Department of Public Health, discouraging people from chronic use of alcohol. So alcoholic kind of picture, but again it can happen to hepatitis B for the drug users. Hepatitis B also happens to be an STI as well. So let me take hepatitis viruses and take you through some of the important concepts that I want to share with you for hepatitis. Again, you can see very symmetrical kind of particles that are there, and most of the time, how would you differentiate between different types of hepatitis? That is done clinically. So there's a clinical scenario over here, and you can see it's from your book as well. So you can see hepatitis A, you get a 37-year-old man, develops fever, and then again develops anorexia, vomiting, and right upper quadrant abdominal pain. That's where the liver is. And then there's a jaundice there, liver failure, sign of liver failure, and then a recovery phase. So that's more of a hepatitis A, which you can see from here, something to do with your GI symptoms specifically. As compared to hepatitis B, you have a young intravenous drug abuser, and then again symptoms after using a dirty needle. So that's where the problem is coming from. Hepatitis B and D again can also come from IV drug users, and this will go and inflame your liver. So if your liver gets inflamed, you are not going to deal with the metabolic byproducts, so they're going to accumulate in your body, and then again you may have altered mental capacity, and then you may have hepatic necrosis and damage. Hepatitis C, again, you'll see elevated liver enzymes, and we can detect that, and you get pretty much the same picture. So 4 different type of cases clinically that we normally see, A, B, C, D, and there are more as well. But you will see they either go from acute hepatitis to chronic hepatitis, and all of them leading to liver failure. Let's take hepatitis A first. You can see from here, it is a single-stranded RNA. It's a picorna virus, so RNA. It is a RNA virus, especially the A one. If you want to look at the structure of this particular virus, so you can see it has a RNA single-stranded. It has a capsid. It is as a small size, and it has 4 viral polypeptides we call VP1 to VP4. So these are important structural element, and there is an important thing we call genomic viral protein. So this is a viral protein which is a genomic for this particular gene. 27 nanometer ball size is a small virus. So what people happen is they acquire this virus by consuming contaminated viral infected food or drink that goes into intestine, crosses, goes to the blood, and then again goes in the liver, secreted in the bile, and passes to stool. So that's an oral-fecal route of spread for this particular virus. And then again, if you look at the time course of viruses, again, you ingest a virus, and then it's going to take you for quite a long period of time in terms of weeks of response. The important thing you will see over here is that there is an incubation period. So in this incubation period, especially the first half, you cannot basically detect virus. The very first place you will detect virus is by liver biopsy. By all means, it's not easy to puncture liver and take the tissue out and look for the viruses, but you can do it. The other alternative is that these people pass viruses in feces. So you can see it starts appearing in the feces. That's the very first response within 2 weeks, and it stays for 6 weeks and disappears. Then you can also look at the clinical picture. So if you look at the clinical picture, you will see these. When you have liver problems, you kind of get like itchiness on your skin. You get jaundice in your eyes, and then many a time, if the liver failure, you pass. They call it like a less brownish or without brownish tinge to your stools because the bile is kind of blocked and it's not been produced, right? It's like clay-colored stool, that's what they say. So you can look for the virus in the blood, or you can look for the antibody, especially HAV-specific IgG antibody. But again, same rule applies. IgM comes first and IgG follows. IgM comes first, disappears first within weeks, but IgG comes late and stays for a good amount of time. If you look at the transmission, we already discussed, it's a fecal oral. So it's coming from contaminated food and water, shellfish, sewage contaminated water, and then again those people who are working in food handling, if they happen to carry that, they're going to pass it on and give it to other people. So who is at risk? Well, people overcrowded, unsanitary condition. Children are always at risk because they cannot take care of themselves. They are dependent, and if they don't have a good daycare or nursing care, then again problems can come. The adults, again, especially in young adults, if they happen to consume that contaminated food, the symptoms come abruptly. Unfortunately, pregnant women may have a highest mortality related to the hepatitis liver infections. This is present all the time, and what you want to do, as I said, you have to make sure what is it you're going to do for food. You never know. But as we said the other day, vaccine is available, so people should get vaccinated for that. Some of the questions I picked up from my last few lectures, and you can see from here single serotype. So again, as a rule, if any microorganism that is single serotype is a good candidate for vaccine. Okay, again, for other important things for HIV vaccine, it doesn't confirm that. So as I said earlier, especially if you're traveling to those countries where the water is unfit for human consumption and there's a high prevalence for hepatitis A virus, and also keep in mind hepatitis A virus is also very prevalent in male homosexuals as well. If you look at the other type of viruses, they are all DNA viruses. So apart from A, so that's a logical question there, apart from A, hepatitis B virus, hepatitis C virus, and hepatitis D virus are DNA viruses. So they are HEPA-DNA viruses. Now, common features for most of the HEPA-DNA viruses that is coming from their DNA nature is that these viruses contain double-stranded circular DNA genome, so that's common among them. And replication is through a circular RNA. They come with a virus, especially they carry their own reverse transcriptase, like HIV. So they don't depend upon your host. And then again, they have encoding for several other proteins that are there in terms of their ability to cause problem. Of all these viruses, especially hepatitis B virus, that's all of you got vaccinated against, and it's mandatory. You can see it is a strict tissue tropism. Tissue tropism is when a virus enters your body, it's going to look for that particular cell it's going to go and attach to. For this particular viruses, it has a very strong affinity for liver. And when it infects the cell, it releases something we call hepatitis B surface antigen. So one of the antigens here on the top is basically released in large amount. And this is what we look for in terms of diagnosis as well. And then again, HBV genome can integrate into host chromosome. What does that suggest to you if I was to ask you, what is the significance of HBV genome integrating into your host chromosome? All the viruses stay with you forever. This suggests to you it's one of the oncogenic viruses. It can lead to cancer. So any virus that goes into your gene, especially chromosome, so HBV virus has a propensity of leading to liver cancer. Okay, now again, especially for hepatitis B virus, these are the risk group. It is endemic in some part of the world. Babies of mother, intravenous drug user, people who have multiple sex partners, homosexual or heterosexual, doesn't matter. Hemophiliacs, because they get repeated blood requirements. Healthcare personnel who have contact with blood, all of us. That's why we all need to be vaccinated. And then again, many other things that you have a chance of getting pricked. So it's like a needle stick injury also, or any other thing that can come your way. So transmission of HBV virus is important. And this is, for example, something that you have to keep in mind when we talk of how virus is transmitted, especially HBV. It can be transmitted hetero or homo, oral drug use intravenous, perinatally, acquired time of birth, and horizontally it can go via your saliva from skin lesions, particularly children's and daycare centers. So that's a typical feature of the transmission of HBV viruses. Now if you look at the particle itself, it's also called Dane particle. If you look on the top, it's like half the size of the one that we talked about earlier. And we have the hepatitis B surface antigen. That's what you see on the top. There's a double-stranded DNA inside, and they are core antigens. So it has two important antigens. Surface antigen called S with small s, and core antigen called C. So you can see hepatitis C, hepatitis B, surface antigen, and then it has some protein kinases. And then again, it comes in two different forms, especially a circular form and longitudinal form. And then again, you can see it comes with a DNA polymerase. The next picture, again, as I said earlier, over and over again, you will see every virology lecture, same scheme, same thing. But we need to know the difference in terms of replication of viruses. First stage is, of course, attachment, uncoating, completion of double-stranded DNA genome, going into nucleus, transcription, translation, all the macromolecular synthesis is made, and then again, it is basically released out into circulation. Okay? Do you see any difference between this replication and the one that I told you earlier? No. Okay. Well, that's fine. So generally, HepRDNA viruses, these are some of the characteristics that we just discussed in the previous slide. HepRDNA viruses basically are as a whole, they are not all hepatropic. See, only one particular one that is hepatropic, others will not be there to cause problem. So they have virulence factors. So they have some kind of factors that will cause their rapid spread. For example, they will have overproduction of excess surface antigen, or they have overproduction of a surface antigen, and they use that as a decoy, and they can neutralize the antibodies that you have. For example, if you've been vaccinated for hepatitis B, so you probably have already built up these neutralizing antibody, but the viruses have a virulence factor. That's why you usually are given 2 booster doses. So all of them happen to be the virulence factors. For the spread of hepatitis B, as you can see, for example, these are the group of people, initial infection. It could be by the needle stick injury, sex, neonatal transmission, IV drug abusers, and if you're given a blood that is not screened for hepatitis B. So of course, it's going to go into your blood, and from blood, it's going to go to your liver. So if you have an antibody, that will stop that step over there from the blood. So that will be your primary protection if you happen to be exposed to this particular virus. So prevents, but if it's not there, it will go into the liver, and then again, liver will process it. So it's going to overproduce surface antigen, and if you have antibodies for this surface antigen, it's going to make those complexes, and you may have immune complex disease. Okay. Now the chances are, if your immune system fights this infection, you can resolve the symptoms. If you do not resolve the symptoms, and you don't have a patent cell-mediated immunity, so you will have viremia. So this virus will go into your blood, and from blood is going to secrete into all your secretions: mother's milk, vaginal secretion, blood, semen, and saliva. That's why it's also an STI, where all these secretions are shared, and then again it's going to go be transmitted to those people who come in contact with all different kinds of secretions, whether it be mother's milk as well. So that's very important for vertical transmission. It's very important for sexual transmission because of it being a part of vaginal, semen, and salivary secretions. Now, if you look at, again, incidences, prevalence of hepatitis B all over the world, and then again, I just told you hepatitis B is also linked with hepatocellular carcinoma. So you will see over here places where have a high incidence of the red color of hepatitis B, and with the circular liver cancer also happen to be the places where there's a high incidence of liver cancer in Central Africa, for example, Japan, and then Far East. There is a very high incidence of liver cancer. And then again, you will see that these statistics keep on changing. I just picked up from your book, so you have an idea as to what are the current trends of hepatitis B virus, and how does hepatitis B virus be related to a hepatocellular carcinoma. Now, remember that once you get infected with these viruses, then there are 2 ways. You get acute infection or you get chronic infection. Now, let's see on the top, for example, you get infected with HBV virus, and you have an effective cell-mediated immunity, so you're going to kill the virus. So you may show acute disease, but it's going to be resolved. Acute disease, you'll have jaundice, and then again, release of enzymes of liver damage, and you're okay. But the other second scenario is that if you have, again, an HBV virus and you do not have a good cell-mediated response, or you have a limited cell-mediated response, you may be able to kill some of the viruses, but the other viruses will remain in your system, and then you will have a chronic disease. So chronic disease, what will happen is that it's going to stay in your liver, and then you have 3 outcomes of a chronic hepatitis or chronic liver disease. Number 1 is that you may get a fulminant hepatitis. It's going to be acute and chronic. Number 2 is that you get cancer, primary hepatic cellular carcinoma. Or number 3, again, chronic inflammation of the liver, which is called cirrhosis. That's what you see in the first picture. There are different types of cirrhosis. One is alcoholic cirrhosis, drug-induced cirrhosis, so on and so forth. One of the important causes is especially chronic liver disease. So you have a inflammation, chronic inflammation of the liver, where liver would not be able to function properly. And then again, there's a drug-induced hepatitis as well. Some of the drugs will go and damage the liver. If you look at the typical symptoms of acute viral hepatitis, so you can see that we relate them into 4 important clinical periods. So you can see once you're exposed to it, there's going to be first part always an incubation period, and you will not see anything. You may see kind of some vague symptom, for example, fever, rash, and arthritis. So these are like 15% of the cases you may see that. Because remember, we are just giving you, most of the textbook will talk about those symptoms which are in higher level of preference. For example, like fever or a rash. But also keep in mind, not everyone will have that, because that's the whole point, that we are all genetically different. You may respond differently to a different virus set. But most of the time, statistically, we'd say 10%, 20%, 40%. I mean, most of the laymen will think, I have a fever, I'm going to take Tylenol, fever should reduce. So you think that Tylenol is going to reduce in fever in every patient? No. And many times, many of the drugs will be approved, even if they show you like 30-35% of the positive effect. So rest of them, 70% still are open, they may not show. So we all are different. That's why I say that we're talking about personalized medicine, we're talking about genetics, we're talking about many things which are going to come up in the near future. Now, once you have a pre-ecteric, so another important thing for hepatitis viruses is that they tend to, sometimes for viruses they have rash, very specific rash, along the dermatome for zoster virus, for example, on the genitals for herpes virus, simplex virus. Some of them are liking for the mouth, but some of them, especially when they form immune complexes, very small, they kind of give you a generalized rash where you feel like itchy, or we call it ecteric. So that's an ecteric phase. So you have the pre-ecteric phase, you kind of feel that, you want to just rub your skin because something's happening there. So itchiness is there. Then, of course, some of the functions are, because if the liver is failing, you have jaundice. And then again, if you have jaundice, you have dark urine, dark color urine. And then some of the symptoms are typical symptoms of liver failure, acute liver failure. For example, if it gets inflamed, it's going to be painful, upper right quadrant. If the liver fails, or the drugs acting on liver where they need to be metabolized in the liver, they will have nausea, they will have malaise, and they have anorexia. So these are the 3 classical figures. The mnemonic for that is MAN, M-A-N. So you have malaise, anorexia, nausea. Pretty much, I would say 100% of people have it. And again, as I said other day, for some other viruses, clinically, once the patient goes to the recovery phase, they will all be reverted back. So you will not have malaise, you would not have nausea, and you will have this desire to eat. So anorexia will be gone. That shows convalescence phase, that shows recovery phase for many viruses that we talk about. And then again, you can see ecteric phase comes third part, itchy phase, and then convalescent period follows that. But acute disease is there for the last 3 phases. The incubation period, we do not know how much that is. So you may get exposed, infected, and there's a time where the virus multiplies, and then you need to respond. If you look at the clinical outcomes, this is basically of acute hepatitis B infection. You will see that luckily 90% will get resolved. 1% will get fulminant hepatitis leading to fatality. 9% of the patients will have surface antigen for more than 6 months. So they will monitor to look at the surface antigen, look at the virus load that you have. So you may start with like 100 viral load, and they want to see a progressive decrease in that 90, 80, 70, so on and so forth. But this will last for 6 months. So now we have half the patients which are going to go through 4 different phases, especially in this one. Number one, even the 9% who have a 6-month extension of surface antigen, they can also resolve. They can take care of that problem. You may have a carrier state where you yourself are asymptomatic but carry it. And then the 2 important liver diseases that we talk about, very common, and you will see again and again, and you will also see in relation to some of the drugs. It's called chronic persistent hepatitis or chronic active hepatitis. One of the commonest questions asked is, which one of these will give you cancer? And you can see from here that chronic active hepatitis is the one that leads to hepatic cell cancer and not the other one. Right? So the idea is that chronic active hepatitis can give you a scenario for both type of chronicity, but as far as cancer is concerned, cancer can only be caused by chronic active hepatitis, and then cirrhosis also can appear. So how do we test these the patient? Some of the questions are going to be from this slide, and you can see from here the test that we have in terms of serology. If you look at on the top one, it goes along the months after exposure, and you can see over here that the virus shedding, that's another concept, the person is shedding viruses. So it is there in the blood, it's there in the secretions, so it's going to be shedded off. The maximum shedding takes place, you can see from here, when the symptoms are on rise. So the upslope of the symptoms, that's where you see maximum number of virus shedding. And if you want to test patient for the presence of hepatitis virus, is hepatitis virus which has a surface antigen. And then again, there is a late response, you can see from here, as far as the liver enzymes are concerned. So you have to look at most of the antibodies that you develop for either core antigen or a surface antigen. So these are some of the tests that we normally do. For example, if you come to a physician and say, I don't know whether I was ever infected with hepatitis B virus, so they're going to run tests for you and tell you exactly whether you have had that exposure. If you want to look at the time after exposure in terms of years, the first picture is pretty much the same. Once you have a hepatitis B infection, you always have presence of surface antigen for the rest of your life. So you can test for that. The other important thing is that if you want to find out whether you have had the infection initially, and then again, you may see that effect in terms of a couple of years after that, we're going to go and test you for the E antigen. So there's an E antigen, you can see that's again important. But the most important thing for this window is that if you have hepatitis B virus active infection, you can spread it in 6 months, but you can also spread it for a couple of years, about like 4 or 5 years after that. So that's again very significant for those people. For example, is a absolute no for the person who has had hepatitis B to donate blood or donate tissue, as a matter of fact. Number 2 is that for STI, sexually transmissible diseases, again, it's going to be over and over again for 6-7 years, even if you have had the first exposure from any of those resources that we earlier discussed. Okay. Now, the question for many of the students is that what is it? How do we diagnose a hepatitis B virus? So, of all these things that we discussed in the previous slide, you can see all of these are considered as a diagnostic test depending upon which window of opportunity you are looking at in terms of weeks, months, and years. But also keep in mind that surface antigen presence alone is not a diagnostic test for HPV. Okay? Few slides for hepatitis C virus. Recently, we have seen a surge in increase in hepatitis C virus. I remember when we were medical students, we used to call this non-A, non-B. We were taught there's a virus called non, it's not an A, not B. So now it basically, they give another name. So you can see things evolve over time. So hepatitis C virus, again, you can see is an acute infection, and there are 3 outcomes for that. You can recover, 15% of the patients recovered, 15% will go to cirrhosis. The problem now for hepatitis C virus is 70%, which is a lot. They will have a persistent infection. And the moment I say persistent infection, you should immediately start thinking of chronic hepatitis, and you should start immediately thinking of cancer. So you can see from here, hepatitis C also can lead to chronic hepatitis and then can have an outcome in terms of hepatocellular carcinoma, though small, but still existent. And then again, cirrhosis again is one of the causes. So if I ask you which of the antibiotics, which of the viral hepatitis can lead to cirrhosis, because cirrhosis is a serious problem in this country. That's why the first impact slide I show you, abdominal distension. Alcohol is #1 cause. Hepatitis is #2 cause. So if you can see, cirrhosis, especially for C, can also come from hepatitis C infections. The clinical scenario, pretty much the same. You can see from here, as we discussed earlier as well, transmission, again, blood, semen, and vaginal secretion. So this is now also considered as one of the STIs. So how do people normally get it? So they can either get it for transfusion, they can either get a needle stick injury. So B and C can come from needle stick. They share the drug, people, sex for intercourse, and breastfeeding. That's another problem for vertical transmission for breastfeeding that it can pass through. So depending upon the transmission, you can correlate who are the people who are at risk. And then again, the modes of control, of course, we have to avoid high-risk behavior. And then again, we need to make sure, as I said earlier, is an absolute no, is an absolute no if you ever had hepatitis, regardless of whatever type it is. But for B and C, they need to screen. Okay? Now, when we talk of treatment of hepatitis, again, there are many things there, but remember, as I said earlier, avoidance of risk avoidment and protecting yourself and care for sterilization and things of that nature. But the most important thing, the active immunization with the recombinant surface antigen basically is not an option. It's not going to help much, especially for prevention of, for the treatment. It can prevent though, but as far once you have it, there's nothing you can do. So you can give it to a high-risk people for preventative measure, but not for the treatment parts, because treatment is a little bit different from prevention. Prevention has to be before you get the disease. The last in series is hepatitis D virus. And again, you look at the size of it. It has a single-stranded RNA virus, the D. And the important thing I would suggest for this particular virus is that another concept from your book, I don't want to go in detail, but keep in mind that they think that sometime you may have co-infection. Right now, I think you would have thought that you get either A, B, or C, right? But in this concept, they think that hepatitis B virus comes with Delta virus, D virus as well, and then again is going to cause all those problems that you basically see. And the whole scenario will be that you get a super infection. So that's what the Delta virus is going to be, a super infection. And of course, this is something new, but by the end of the day, you have the same outcomes of liver damage. You can either have an acute hepatitis or can have a chronic hepatitis. And I would rather want you to spend a little bit of time and I'm going to do it myself as well, to make a chart and put all these different type of hepatitis in one table and kind of spend a little bit of time on that, So you can see these are the features that we are concerned. We want to see what is the virus there, how are they transmitted, how is the onset, what kind of incubation period you're looking at, severity, mortality, chronicity, and then lab diagnosis. This is a common question that you may ask whenever you come across a patient of hepatitis. And then you can see hepatitis A, B, C, D, and E. And I said many more, but I think probably your book has been talking about that. So A is called infectious because of the oral food consumption nature. B is a serum. I told you in our time still has the same in non-A, non-B. That's what we were taught at that time. So pretty much there's a common name for, because those people who knew it at that time, they are the people who are teaching people at that time, so professors. So they kind of have this nostalgia feeling to use the same name. D is a delta agent, and then there's another enteric, again, non-A, non-B, hepatitis E. And then you can look at the structures that we have. We already discussed that. I want you to pay attention to the transmission, and you will see the hepatitis A and E are fecal oral, whereas B, C, and D are either parenteral, injectable, or sexual. So we do say B is a sexual transmissible infection, but anything, if the virus is there in vaginal, semen, or salivary secretions, that pretty much there's always a chance that people are going to acquire that. As far as onset is concerned, you can see some of them are abrupt right away, but some are built up, insidious. It's kind of a built up, so it's kind of a window where you can wait and things will kind of come up. And if you look at the incubation period in terms of days, so you can see anywhere from 2 weeks to a couple of months. So virus is going to sit in your system and look for opportunities, penetrate, go here and there. And then as far as severity is concerned, you can see that it's all the way from very mild to very severe form of the disease. And as we discussed earlier, some of the groups of the patients, especially pregnant women, are at high risk, and we have to take a interventional approach and want to help them out. The highest mortality that you have is for hepatitis C, as far as percentage is concerned, 34%. And then again, all of them stand a little bit lower in terms of percentages. If you look at the chronicity, and remember chronicity means that they're going to go into chronic active or chronic passive hepatitis. Chronic active hepatitis is called CAH, and chronic persistent hepatitis is called CPH. You'll see quite a few cases. And then A and E, which are infectious, they do not have that ability to cause chronic liver disease as of now. But the other one, B, C, and D are there. And again, you can see from here, hepatocellular carcinoma for B and C. And again, cirrhosis for these, same as well. The test, you don't need to remember much. If you do, then you just can read it up. But you can see there are tests available where either we see an antigen, which is a surface antigen, or we see a core antigen, or we see a response in terms of antibodies that we may have in this particular set of infections. Any questions? Because I do have time to take questions today for these hepatitis lectures. So what I want you to do is that you can see from here, most of the questions for this part of hepatitis is going to come especially from this table, because you need to compare, contrast. What are the different type of hepatitis viruses? What is their structure? And then again, how do they transmit themselves? What is the incubation period? And I told you about the incidence of cancer, incidence of chronicity, incidence of them being vertically transmitted, especially for pregnant women and babies, and which one of them are considered an STI, right? So keep those in mind, and I think that should pretty much take care for hepatitis virus. Okay? All right. Thank you.